Good morning, everyone. My name is Nkechi Ogbo, and I am the Health Education and Community Engagement Pharmacist here at Texas Southern University's College of Pharmacy and Health Sciences. You are again welcome to today's second annual Tech and AI conference entitled Technology, Artificial Intelligence, and Social Media in Healthcare. What do I need to know? I hope that's a question we've asked ourselves. And please, it's going to be an engaging time and engaging next 2 hours. Want to appreciate everyone for taking our time to join us. Want to appreciate again the speakers, the panelists who have giving us of their time this next 2 hours to share invaluable information. And we're really grateful for this opportunity. Next on, I'm going to bring up to the stage Dr. Poon to give us the welcome and agenda review. She is a professor in the pharmacy practice and administration department in the College of Pharmacy and Health Sciences. And she's also the assistant VP for faculty development here at TSU. Dr. Poon received her Doctor of Pharmacy from the University of Houston and a Master of Science in Palliative Care from the University of Maryland and Baltimore. She is a licensed pharmacist and also a preceptor in the state of Texas and has served as a clinical pharmacy specialist and preceptor for many pharmacy students at the Geriatrics Clinic in the Michael E. DeBakey VA Medical Center here in Houston, Texas for more than 20 years. She has served also as a mentor for many junior faculty in research and professional growth, and her research interests are geriatrics, pharmacotherapy, palliative care, and pain management. Over to you, Dr. Poon. Thank you.
Good morning, everyone. Hello, welcome. So in the next couple of minutes, I am going to go through the agenda and then go through a couple of housekeeping items. We have a full pack of lineup activities with awesome speakers and panelists. We will have open remarks, and then we'll have a community engagement core overview, followed by we have four amazing speakers that we are very excited to learn from. And then after that, we'll have a panel discussion and closing remarks. So we are so excited for today. And a couple of housekeeping items is on the next slide. So all attendees, please post your questions if you have any in the Q&A box, and our staff will check and answer them and have time to answer those accordingly. The survey link will be posted. You can also use the QR code to access the surveys for this conference and also for the CHW survey to claim your CHW CE hours. This offering will offer free 2 credit hours of CHW credits, and you have to complete the survey and evaluation to receive this. We will be streaming live on Facebook and YouTube, so please hashtag at CECTX7U and share our offerings and share our conference to your community. So thank you so much, and we are so excited. So in the next slide, I will introduce our amazing and awesome leaders, Dr. Esther Arek Olayeye, and she is our Senior Associate Vice President for Research and Innovation here at Texas Southern University. She is also a professor in pharmacology. Her formal training in pharmacology and epidemiology were at Johns Hopkins School of Medicine and Harvard University. Dr. Olayeye has a strong background and expertise in biomedical research and public health spanning over a combined 21 years, working on research programs focused on disease that disproportionately affect underrepresented minority and underserved population. Dr. Olayeye was a 2023-2024 American Council on Education Fellow, working on with the Chancellor of the University of Texas System. Presently, she leads a $8.63 million NIH-funded Center for Biomedical and Minority Health Research program. Recently, Dr. Olayeye received the HRSA Award, $2.4 million, to support establish of the MH-REACH program on maternal health research, education, training, and community engagement. By the grace of God, under her leadership, TSU maintained and was reaffirmed high research activity R2 status by the Carnegie classification in 2022. Under her supervision, TSU's drug discovery research experience tremendously grew, including the development of several advanced research infrastructure and core facility, state-of-the-art instrumentation equipment, increased grant tracks, synergy of community engagement infrastructure and resources, and strengthening strategic partnership. So let's welcome this awesome leader from TSU, Dr. Olayeye.
Thank you so much, everyone. Thank you, Dr. Poon, for your kind introduction. It's my absolute honor to be opening up this amazing conference that brings together innovation and artificial intelligence and research, and more importantly, healthcare delivery. I would like to say a big thank you to Dr. Veronica Ajewole for being our AI champion at Texas Southern University, really being the brainchild behind this conference, as well as all her team members, our leaders, as you're going to hear from most of them today, on this amazing conference that I believe will really be transformative. As Senior Associate VP for Research, I'm both inspired and really challenged at the pace at which artificial intelligence is transforming the fabric of our society. It's no longer a frontier of possibility. It is presently here, and we have to embrace it, utilize it, and also provide guidelines, ethical guidelines. I hope you learn a lot from our speakers today, our panelists, and our goal as a university is to continue to foster an ecosystem where AI development and creativity is deeply at the root of transparency as we deliver great healthcare to our society, and more importantly, the communities that we serve. We're investing, and we've invested a lot of funding into artificial intelligence across the university, from education to research to community transformation. We've developed a lot of partnerships with our industry partners, and we look forward to seeing how we can all come together to build this huge ecosystem and use artificial intelligence to transform our society. Thank you again, and I look forward to enjoying this conference as well. Thank you.
Thank you so much, Dr. Olayeye, and we just noticed something in my tech. But without much further ado, I am going to also go ahead and introduce the host of today's event, Dr. Veronica Ajewole Muema, who serves as a professor of pharmacy practice, as well as the assistant VP for clinical translational research and community engagement here at TSU. She is a clinical pharmacist and also an adjunct assistant professor of oncology at Houston Methodist Hospital. She received her PharmD from yours truly from here at TSU, and also completed her oncology pharmacy residency at Houston Methodist Hospital. She is a board-certified oncology pharmacist with clinical practice in oral chemotherapy at Houston Methodist Hospital Cancer Center. She's also the founding director of the NIH MD-funded Community Engagement Core at TSU's Center for Biomedical and Minority Health Research and TSU's Institute for Health Empowerment Advancement, research and training. Dr. Ajewole Muema is the convener, of course, of this conference, and we're very excited to have her present on our various health empowerment programs here at TSU. Over to you, Dr. Ajewole.
Awesome. Thank you so much, Dr. Ogbo, for that generous introduction. And I say it often, every time this bio is read, I totally diminish and I give God alone the glory. I am very excited to be on this call with everyone this morning. Thank you all so much for joining us from different places, wherever you are at. A big thank you to all our speakers and panelists that we'll be hearing from shortly during this session. Dr. Olaleye, that was an amazing opening remark. Thank you for your leadership. Many thanks to you for your mentorship and your support, and to the entire leadership of our very own Texas Southern University. We are just very grateful to have an opportunity to host everyone in today's event. Over the next few minutes, I have the privilege to give us an overview of some of our grant-funded programs here at TSU, where we are very intentional, very deliberate in addressing and advancing health outcomes in our community. The first one that I will talk about is our RCMI Center U54 Center that we have here at TSU, which is a big center grant called the Center for Biomedical and Minority Health Research, led by Dr. Monique Olaleye, Dr. J, and Dr. Liang, alongside myself, Dr. Gao, and Dr. Poon. Thank you so much, Dr. Poon, for running us through, the plan for today. We are just very grateful to you for your support and for your leadership, helping us to steer this big wheel of the community engagement part. Under the umbrella of this center, there are many aspects, many cores, but I'm going to focus primarily on what we do here in the community engagement core, where we have three major responsibilities. The first is for us to identify and address the health concerns of the community. What exactly does that mean? That means that we listen, we engage with community members, we are able to understand what the health needs of the communities are, and then develop programs, initiatives, measures like this addressing those health-related concerns. Additionally, we also put in efforts in increasing research participation, and lastly, disseminating research findings in a non-traditional manner. When we look at the scope of the activities that we do, we are very intentional, by God's grace, in collaborating with federally qualified health centers, community-based organizations, faith-based organizations, healthcare systems, industry partners, community members like yourselves, as well as our elected officials in hosting seminars that we host every month. We've been able to do this over the past 4 or 5 years, having an event of this manner, some smaller scale, some bigger scale, but every single month we have reached out by providing education to the community. We host outreach events, conferences, and also maintaining presence on social media, mass media, and print media. We're also very intentional in bringing education to the community, and we do that by providing community health workers continuing education. Several of you that are logged on today will be able to receive free community continuing education credits, and we also engage with our high school students, because that's the future, ensuring that our high schoolers are also attuned to what is going on in the community and that they are better positioned to join the biomedical research pathways. Trust building is a main aspect of what we do, and we do this by engaging in surveys, focus group, and community engagement studios. Throughout today's event, we will be posting in the chat box links for you all to be able to complete the survey, so that way we continue to listen to feedbacks from the community, and we remain responsive in meeting and fulfilling the goals for the community engagement core. Over the past 4 going on 5 years, we are just very blessed, incredibly blessed, to share that we've had significant impact in community engagement activities. In hosting events like this, we've had over 5,000 individuals attending this event. We've had over 1,000 people attending events specifically on clinical research and engagement. We've maintained significant presence on social media, mass media, just being very intentional in meeting people where they are. And we could not have done any of this without the support and partnership with community members like yourself. So thank you for joining us for this event. And I'm going to talk more a bit about some of our clinical research related infrastructure. As part of the goals that we have for the community engagement core, we are very intentional in addressing the education gap and building trust around clinical research. Annually, we host the conference called Clinical Research and Engagement Conference. And this past year, we had almost 500 people attending this event. We've brought in speakers from different places, those that have participated in clinical research in the past, those that are supporting, the clinical research process, all pulling in efforts and resources together to empower the community regarding clinical research. Not only have we been able to successfully share information with community about clinical research participation, we are very blessed, incredibly blessed, to also now establish our own Center for Clinical Research and Translational Sciences. Myself, alongside Dr. Monica Olale and Dr. Poon being the leaders for this center, with our robust support team of Dr. Ogbo, Mark, and Edith, partnership with UTMB. UTMB, I say that all the time, they are heavily clinical research proficient. For us at Texas Southern University, we are clinical research naive. In collaboration with UTMB under the leadership of Dr. Randall Urban and his amazing team, Texas Southern University has successfully established its own Center for Clinical Research and Translational Sciences. Of course, making sure that it's a win-win for everyone involved. For us at TSU, we have our goals of ensuring that our community is not left behind when it comes to clinical research participation. And then for UTMB, they are also very involved and engaged, ensuring that our infrastructure is built and that they continue to provide that backbone support for us here at TSU. Because we listen very intentionally, ensuring that we remain responsive to the need of the community. We're excited to tell the community this morning that we have successfully established a community advisory board supporting the implementation of our clinical research initiative. The faces that you see on the screen this morning are the individuals representing the Houston community from different walks of life, bringing the voices to the table as Texas Southern University is taking a lead in establishing a unique and innovative clinical research center for the community that we serve here at TSU. One of the first steps in the right direction regarding this clinical research initiative is that we have recently launched our clinical research registry. And if you ask me like, hey, Veronica, what is a clinical research registry? What exactly is that? A clinical research registry is a platform that allows those who are interested in participating in clinical research to engage and have their information in a pool such that we can connect these individuals with future clinical research programs and clinical research initiatives. So if you are interested in participating, if you are interested in joining the clinical research registry, a link is being posted in the chat box. Click on that link. One of the first things you will see is a link that will take you to a place where you can pre-register to be part of our clinical research registry. Our clinical research team will contact you and be able to obtain additional information, guiding you through how you can be a part of clinical research registry, and most importantly, to advance health outcomes for ourselves and for the community at large. As I move away from, the clinical research registry initiative, I'm going to talk briefly about some additional grant-funded programs that we have here at TSU. Very excited and really blessed that over the past 3-4 years, we received funding from CPRIT. CPRIT is a cancer prevention research institute of Texas, $1 million award that I have the privilege of leading, where we provide mammogram at no cost to uninsured and underinsured women. We've done this successfully, again, in partnership with you, the community, to where we've been able to provide mammogram to over 1,400 women, education to over 4,000 individuals, patient navigation services to over 4,000 individuals. And most recently, within the past 3-4 weeks, we are very, very excited to share that we received additional funding, $2 million award received here at Texas Southern University that will allow us to continue implementing this breast cancer screening initiative, spreading it now to 9 counties, and also providing services to 2,400 women over the next 3 years. I have the privilege to lead this round, and I'm just very excited to be able to continue to provide these much needed services to the community. For those that have been following us for some time, you would have had me, excitedly share about our mobile unit. And if you ask me, hey, Veronica, where is your mobile unit? Guess what? Our mobile unit is now here in Houston. Our mobile unit has been recently delivered. It's currently here in Houston, and we are working through logistics, finalizing some plans that will make this mobile unit be deployed to provide services to the community. So over the next few months, you guys are going to see our mobile units on the streets, on I-10, 3rd Ward, 5th Ward area, and, providing services that is needed to the community. I'm going to go through a couple of additional funded initiatives that we have. We have our P20 Cure program that allows us to train 80 students at TSU in biomedical and cancer research pathway. We are deploying this in collaboration with Baylor College of Medicine. We also received an award led by our very own Vice President, Dr. Michelle Penn-Marshall, alongside Dr. Ivy Poon, where Texas Southern University is deploying additional infrastructure that will make us a research-intensive institution. Dr. Olaleye mentioned, or when Dr. Olaleye was introduced, there was a brief highlight about the $2.4 million award, where TSU is again very intentional in addressing the gaps in mortality and morbidity for maternal child health in our community. And in addition to this, we also have, the Gulf Coast research program that allows us to connect commercialization with the community, making sure that the community voice is no longer at the back. Now we're bringing community voice to product development and innovation breakthrough. All this infrastructure is all tied in together in our Institute for Health Empowerment, Advancement, Research, and Training that allows us to continue to empower the community in what we are doing regarding health advancement and outcome. With this being said, you might ask yourself, okay, so why are we having this conference? Dr. Olaleye was very right, in our opening remark, as she shared with us that AI is not an aspect that we can ignore anymore. It is here, it's here to stay, it's here to transform our lives, but we have to be prepared to be able to adapt, our day-to-day activities to utilize artificial intelligence, social media, and technology to improve our health. So that is why we are gathered this morning for this conference, and we hope that listening to our speakers and the panel discussion, the community will be empowered to use AI, social media, and technology effectively in addressing and advancing health outcomes. I will wrap it up this morning by saying a big thank you to our team. I have the privilege to lead an amazing group of individuals whose faces you see on this screen this morning, and just telling them a big thank you. I could not have done it alone without the support of this amazing team member. So thank you all for joining us this morning. And I know the remaining hour or hour and a half of this conference is going to be an amazing session where each of you will get great information to improve our health outcome. Dr. Ogbo, I will pass it back to you. Thank you.
Thank you, Dr. Ajewole, for that great introduction. I am going to share my screen now and just give us a few housekeeping rules. Please let me know when you all can see.
Yes, we can.
Thank you. Not sure if I'm having, it's not advancing. Dr. Ajewole, if you don't mind, so I don't waste time, do you mind resharing your screen so I can use those? Thank you. All right, thank you everyone for your patience. And then on to just giving us a few things, just housekeeping rules for this webinar. Regarding our attendees, thank you again for joining us. And please post your questions in our Q&A box. I know someone already asked one and we responded to that immediately. The survey link has been posted, and if you need it to be reposted again, please just let us know. But we'll do that frequently throughout this session. For our community health workers who have so graciously joined us, please, this is going to be a two-hour continuing education credit that you can get from us. However, you please have to complete the survey and evaluation to receive full credit. Go ahead and scan the QR code if you want to, or even on clicking on the link in the chat box, and that should work for you. For those who are streaming live on Facebook and YouTube, we also invite you to please go ahead and reshare to your friends and to everyone who you feel will benefit from this information. Stay connected to us via our various social media platforms, which are the X, Instagram, Facebook, and whatnot. Thank you all. Appreciate it. And on next to our presentations. The first presenter today is Dr. Tamika Cross, who is a board-certified obstetrician and gynecologist. She's also the CEO of Opulent Health and Wellness in Pearland, Texas. And there she provides comprehensive patient-centered care. And she has been recognized among Becker Hospital Review's top 60 most powerful people in healthcare and Houston's top doctors. She has also received United States congressional recognition. She's very passionate about addressing maternal morbidity. And she also has served and continues to serve in hospital committees and educates through speaking engagements and social media. She is the author of What a Doctor Looks Like, a memoir inspired by her viral campaign against medical discrimination, and has been featured in outlets like CNN, Forbes, and the New York Times. Dr. Cross is a graduate of the University of Michigan, Meharry Medical College and UT McGovern Medical School, where she serves as chief resident. Dr. Cross balances her career with family life, enjoying time with her daughter and outdoor activities. Everyone, Dr. Cross, thank you. And you can feel free to share your screen, Dr. Cross, and advance your slides. Dr. Cross, feel free to share your video and also advance your slides, or if you need help with advancing, do let us know. Thank you.
Just give me 1 second. I'm just sharing the screen right now.
No problem.
Just want to make sure you can see this. And I'm okay with advancing my own slides. Do you see my screen or no? Because it's sharing.
Not yet.
It is not. It says it's sharing, but I see on here that it's blank. You pulled up my slides. It looks like.
Yeah, we can see it now, Dr. Cross.
We have pulled yours up, Dr. Cross, so I think you can probably use this one on now.
Okay, I apologize. I don't know why it's not working. So we're gonna go from that screen then.
Yes.
Okay. Sorry about that. Let me start my video. So good morning, everyone. I'm so happy to be here today to join for this conference. I was very excited when I was invited for this opportunity to be able to talk about something that I have incorporated into my life and my practice. And so we're going to be talking about healthcare meets hashtags. So using social media to educate and advocate. Go ahead to the next slide. So I wanted to start off and just talk about a brief introduction on why something like this is important to even talk about. We think about social media, we think about all the different ways that people use social media, but we don't talk about enough how we can incorporate it into our professional lives. And so me specifically being a physician and how I'm able to use social media and how my patients use social media. And so we're going to be talking about that today. So I just wanted to start off, and I don't think we can really necessarily get the participation virtually to see, but just asking you all, how many have searched TikTok, Instagram, YouTube, or Google for health information? So, as soon as you get like that headache, as soon as you get like some type of blink in your eyes or knee pain, the first thing you do is go to TikTok, IG, YouTube, or Google for health information. So I just want you to think about that as we progress to the next slide. So here's the statistics. So 41% of people who say social media would affect their choice of specific doctor, hospital, or medical facility. So that means that when they're looking for a doctor, they're going to social media. They're going to social media to look up the doctor, to look up the practice, to look up the hospital, where in my case, I do OBGYN, so where they may deliver at. They're looking that up. And this number has increased significantly over the years. 80% of social media users have looked for health information online regarding diseases, procedures, and healthcare professionals. So again, when people always talk about going to WebMD and things like that, which we're going to talk about a little bit later, but social media, using that to look for health information. So 80%, that number is extremely high and much higher than it was in previous years. And then 60% of social media users trust social media posts by doctors over any other group. So I think that's important to highlight as well, because I think it's important to look at the source. We can go to the next slide to look at the source of where the information is coming from. So again, there's some statistics here that talks about, it breaks it down based on generation. So if any doctor or healthcare provider that is like myself, where I'm an OBGYN, and so a lot of times people focus on the OB part and think that I'm really just treating patients in their reproductive prime, but I do so much more than that. So I have patients as young as 8, 9 years old. I have patients as old as 99, 100 years old. So I have all the different generations that come into my practice, into my office. And so I think it's important when you're taking care of multiple generations to know how to reach the generation that you're tailoring to. So we have Gen Z, millennials, Gen X, and baby boomers. And so as you can see here on this chart, search engines, the top line is looking at search engines. So using like Bing, which is a little bit more outdated, Google, to look up medical information. Do they begin their online research for medical information? And so as you can see, baby boomers, 72%. Gen X, 75%, millennials, 67.8%, and Gen Z is 65%. So a lot of people, majority of people across every generation there is using a search engine to start their online research for medical information. And this was in 2023. It's probably even higher now. And so I like to look at that. And so as you look at each of the different lines, the bottom one there is social media platforms. So using Facebook, X, formerly known as Twitter, looking at Instagram, Snapchat, TikTok. As you can see, baby boomers, we're only at about 3.8% that are using that as where they start their online research for medical information. But Gen X is 9.7%, millennials 25.8%, and Gen Z is 28.8%. So as you can see, the younger generations are definitely using it a lot more than the baby boomer population and older. But again, I think it's important to know as healthcare providers who your population is, who your audience is. We can go to the next slide. And how to target them, because the marketing people, they figured it out already. So this is social media usage in healthcare marketing. So if you notice, you're on Facebook, you're just trying to look at some pictures from the last year's family reunion, things like that, and different marketing ads or things like that will pop up. So for healthcare marketing, it says 98% are using Facebook. 94% YouTube, 92% Instagram, and all the way on down. And so if the people who are advertising things like a new medication, a new pill, a new procedure, things like that, they're marketing to the places where people are. So if they are on board, we need to get on board as well as healthcare providers. Next slide. So again, 80% of internet users use search for health information online using all the different social media platforms that we talked about. And it's important to know that physicians, hospitals, and public health agencies are using social media to educate and engage the community. So it's not just one subset. Next slide. So as you can see, there can be a lot of positive things that can come from this, but there's also some challenges that can come from it too. So talking about some of the positive opportunities, education and health literacy. So I am big on that. So I love taking something that is maybe a complex medical issue and breaking it down and simplifying it, taking out some of the complex medical jargon to be able to be understandable by all populations, right? And so we do that as physicians. We should do that as physicians, and talking with our patients and explaining to them using non-medical jargon to understand a complex issue. And so social media allows that. I always joke around and tell people that, you know, we all have attention span of 90 seconds or less, because the average reel is 90 seconds or less, or on TikTok. And so being able to take a complex issue, say cervical cancer screening, right? Instead of having a 5-6 minute video that people aren't going to watch, talking about it, being able to use a fun trending audio or something like that to be able to, okay, here's the 5 things you need to know about cervical cancer screening. Boom, 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 boom. And that is how we are getting our information nowadays. And so now, even if we're not comfortable doing it, I do think that there is a space for us as healthcare providers to be able to simplify this complex information in a way that is understandable, fun, and is direct and to the point, and patients like that. We're also able to reach a younger, diverse audience and people who may not have the same access and may have more barriers to care, whether they're uninsured, whether they can't get to the doctor. They can go online and get stuff from a credible source. And again, this is general information, not medical advice. Myth busting, I do that as well. I do OB-GYN myths debunked because I hear so many different myths that people get from TikTok and things like that. So there's so much misinformation, which is actually one of the drivers that drove me to even start my social media page a few years back, was because I wanted to be able to try to combat the misinformation that's out there. Because patients come in and they're like, oh, well, I heard this, and I heard if you put this in your vagina, this is what, and I'm like, no, please don't do that. So I think that is important. From an empowering patient standpoint, that's important because we're encouraging self-advocacy. So there's so many things even outside of just straight up medical situations. We're educating about medicine, but just, you know, different situations that happen. Like, hey, I went to this hospital, they didn't hear me. I asked to speak to somebody else. I asked for a second opinion. I went to this hospital because they didn't hear me. I went this. And it sucks that we have to do that, but I think it's important that we can talk about these things and to encourage people, and our patients and our communities, that they have a voice and they need to use it, and that their voice is powerful. It's also a good place to be able to increase awareness of health screenings and preventative care. So, I mean, we always knew about breast Breast Cancer Awareness Month, right? Because Susan G. Komen Fund, they always do a lot of things around October. So we know October, everyone's wearing pink. You see it in the different professional sports. They're wearing pink socks or pink shorts or pinks on their jersey with the breast cancer symbol. So we know about October, but there's so many different awareness months that now we are more aware of because of social media, right? So knowing about cervical cancer, ovarian cancer, mental health awareness month, heart awareness month, there's all these different months, and now we're increasing awareness about things that we did not necessarily know or have as readily available at our fingertips. Representation is important. I will always say that patients want to talk to a provider that is relatable. They want to talk to a provider that feels like they're talking to, their family member or somebody who really hears them and understands them or comes from a patient population similar to theirs. And so that is always important. And that is why a lot of patients do look for physicians that look like them. So being able to have that access online, having that presence on social media is important because we're able to collectively break stereotypes and talk about maybe certain health disparities that affect a certain population. So if I'm on there and I'm talking about preeclampsia, well, a lot of my patients have had preeclampsia or do get preeclampsia because I take care of a lot of Black and brown patients. So versus somebody who doesn't look like me may not be talking about that as much because that's not their patient population. So I think it's important to recognize that professional networking with mentors, peers, community building, reaching underserved and marginalized communities, that's a big one. And then, of course, we can't ignore the fact from a public health standpoint, the rapid dissemination of evidence-based information. So we saw that with COVID-19. That was a crazy time. And we saw the guidelines changing literally within hours. Like what we're supposed to do 4 hours ago is now different than we're supposed to do now, as far as the PPE, as far as is it airborne, is it not, is it droplets, and all these different things, and taking precautions and social distancing. And so that information was disseminated using social media. And I think that is really how we learned about the pandemic, but also were able to navigate the difficult parts of the pandemic as a result of social media. So these are all positive things. Next slide. But of course, with positive, oh, I'm sorry. Okay. So of course, with positive, there's also some challenges as well. So online bullying, patient-provider boundaries. I've had patients contact me for medical advice that is not appropriate. And so sometimes there's challenges with that. I've even had a patient send medical records, which is not HIPAA protected on social media. So data security incidents, ethical dilemmas, etc. You can go to the next slide. So how do we effectively use social media? So as doctors and healthcare professionals, I think it's important that when we're going to say something that we should verify and cite credible sources, protect patient confidentiality, engage respectfully with differing opinions, which there's a lot on social media, and use disclaimers saying that this is education and it's not medical advice. So people know that they can take it back to their healthcare provider and tailor it to fit their needs, but it is not medical advice. Go to the next slide, please. Next slide, please. These are just examples of some viral educational campaigns that I have here. And so just talking about Black Maternal Health Week, COVID-19, the ALS Challenge, which helped to increase awareness. Next slide. And then this is an example of one that I was particularly involved in with the hashtag What a Doctor Looks Like when I experienced some discrimination on an airplane trying to help an unresponsive passenger. And so I took to social media, and this was before I even had an IG, took to social media to talk about the situation, and it started a movement. Go to the next slide, please. It started a movement where it showed just, that we exist in all different spaces, gender, ethnicities, background, that there's not one certain type of way that a doctor looks. And so I think it's important to know that there's a lot of positive things and viral campaigns that can come out of social media in the education space. Next slide. So where are we going with social media and healthcare? So AI, and so I know we have some people who are going to talk about that today, so I'm not going to jump into that. But telemedicine, integration, health equity, and amplifying marginalized voices. Again, I want to emphasize that. Next slide. So takeaways. So social media is not going anywhere. I know you said that earlier. If we don't occupy this space, someone else will, and they may not have the accurate information. So I feel like as a healthcare provider, whether we like social media, whether we hate it, I feel like we do have a responsibility to occupy this space and put good information and accurate information with credible sources out there, because someone else will, and patients will come in with misinformation and sometimes even follow it as medical advice. So I just really wanted to hone in on that, and happy to answer questions at the end.
Thank you so much, Dr. Cross. Thank you for increasing our enlightenment. And then up next is Mr. Uche Ogbo, who is an IT industry specialist, but he's an engineer and a technology enthusiast with 20 plus years actually in the IT industry, working for companies responsible for building cutting edge technologies and products. In his spare time, he enjoys gardening, DIY projects, and exploring new investment opportunities. Over to you. Would you like to share your screen, Mr. Ogbo, or would you like us to assist with that?
I'd like to share mine, please. Thank you. All right, thank you very much. Well, let's pull this up. Please let me know when you can see.
Yes, we can.
Oh, how do I make this full screen? I'm not familiar with Zoom.
Underneath on your PowerPoint slide, just click on the presenting.
Oh, yeah, I see that. Thank you. Slideshow. Okay. Thank you, everyone. We got this out of the way. My name is Uche. I'm based out of Houston, Texas, and I work in tech. I'm honored to be here. Thank you for the opportunity to present this topic. So we're going to dive into, obviously, 12 minutes is limited time, but we'll do our best to respect that and share some valuable information. Hopefully, it'll be useful for the audience today. So Dr. Cross had touched on some of the things that I'll be sharing here today, especially the Google search aspect of it. And those metrics that you shared, it's very insightful. It gives us an idea of how relevant these tools are these days. And one of the last things you take away is that these things are here to stay. They're not going anywhere. So it's very important that we embrace them, make the most of them, but also using it, in a very responsible way. So digital health shift, that's more and more relevant these days. There's the idea that you can sit in the comfort of your home and you can consult a doctor via telehealth is amazing. You don't have to drive into anywhere. You can schedule that and have a consultation with someone on the other side. Obviously, there's some limitations to what they can do, but that advancement is very, very key to our overall health and wellness. So these days, there's a lot much more information at our fingertips because everyone has a cell phone, a tablet, access to internet. It's the penetration data in the US is staggering. Almost every community has coverage. So it's never a question of you do have that access once you have any kind of data plan on your phone. And with tools like ChatGPT, which is artificial intelligence, and Google search, these are go-to resources for health questions. So the question here is, how can our communities, the underserved communities, best use these tools for the health and wellness journey? And we will try to answer these questions and shed more light. So the tools that we're going to focus on today are ChatGPT and Google search. And, just so we can make sure we're all on the same page, ChatGPT is one of the many chatbots that are available right now. Almost every major company has a ChatGPT equivalent right now, but ChatGPT was the first to the market. Very easy to use at the time, still even now, but much more advanced at the moment. But it's basically AI-powered conversations. It's based on large language models, basically trained with large volumes of text so that it can as close to as close to possible speak or communicate like a human. That's the whole notion. So that when you're chatting with this bot, you can be confused sometimes if you're chatting with a real human or an actual robot. And ChatGPT can explain complex topics. You can ask it literally anything. It can summarize a lot of information, so you don't have to read through tons and tons of stuff, and it can answer questions. Read any questions, it would answer. Now, the caveat here is the quality of that answer. At the beginning, there was a lot of concern about hallucinations where it would just make things up, like a 5-year-old trying to lie about something. It would just make things up because it has all that text. It would just stitch text together and give you an answer. So you had to do additional validation. But it's improved now, and that hasn't gone away completely. It's much better. Google search. Google search is the whole idea of Google. Let me go Google something. Just shows you how prevalent, how much it's woven itself into our everyday life. It's a term now where you search for stuff online is Googling. Whether you're using Microsoft Bing or Brave or other tools, but you say I'm going to Google, you're searching anything, it's Googling. It's basically access to vast amount of information online, including health and wellness, obviously. So it's able to connect to different websites, medical sites, different articles, different forums, and is scraping all this data for you, and then it ranks it based on relevance, and then often is the first stop for health queries, like Dr. Cross pointed out with that statistics he shared. A lot of people go to Google first to ask questions about, why am I having this headache? If it's pounding on the left, what does it mean? If it's on the right, what does it mean? If it's in front, all these things we ask. Every healthcare, every health issue we have, a majority of us, the first thing we do is to go on Google and do a search. One thing that Google has done recently is to enhance their search experience by adding an AI overview component, which they incorporated recently. So it summarizes, instead of you having to click through all the different websites to figure something out, it'll give you a high-level overview of the data based on how you prompted it, how you asked that question. It would help you summarize it so you have some insights before diving in. Okay, so we understand the players now. Why does it matter to us? Basically, we need better access to credible health information. This is crucial. There's disproportionate rates of conditions for different communities, whether it's hypertension, cancers, heart diseases, and so on and so forth. So having something that can help give some clarity is important. And that's where these digital tools help come in, that can help bridge these gaps if used wisely. What are the benefits of these tools? We know that they can help, but how can they help? It would help with better health literacy. So understanding some medical terms, you could hear some things and you go search and figure out, oh, that's what it means. It helps you become a little bit more informed about what you're dealing with. Even before going to the doctor, if you do some searches and you engage and ask these questions, it gives you're better informed. I'm not saying go and argue with your doctor or anything like that, but at least it helps you ask more intelligent questions about what's going on. And it makes the doctors, you're paying for that service. So make the doctor work for you. Ask very deep, insightful questions, and the doctor will sit on their toes and know that, oh, so-and-so is coming in today. I have to be prepared so I can answer those questions that they come with. And that's what this can help you with. So the preliminary information, when having that access is challenging. And then, like I said, it helps you to formulate those questions when you do meet with your healthcare providers. So self-advocacy too. I'm not advocating for self-medication, which is what a lot of us now do, where we go to Dr. Google and it says you have to take this, and we swallow it hook, line, and sinker, and we start self-medicating. No, but it's basically having some more confidence when you discuss these topics with doctors and healthcare professionals. It gives you insights. You've done some research and okay, these are the the ranges of this experience, and then you can have that conversation with the doctor. So your for your own best interest, you have this information and you're utilizing that information to have better awareness and better knowledge. So public health awareness as well. So information on different screenings that are out there, different preventative measures, finding out, what the cultural, you have to be culturally relevant, obviously, even though this has its limitations. So now you can search for questions about, why does, like for me, for example, I go to see the doctor and I see my blood work, and I was worried at some point, but doing some research and having conversations with doctors and specialists, and they're like, yeah, because of where you come from, it's normal for these date ranges to be your case. It's not something to be absolutely freaked out about. It's just based on your genetic makeup. So that helped take a lot of weight off my shoulder, but it helps when you're able to know how to use these tools. But obviously there has to be some guardrails, if you would. So we're going to talk about best practices. Always get to the doctor first. Consult a doctor, consult a professional, consult someone who is trained in that thing. The information you get from ChatGPT or Google search is not a substitute for advice from your doctor or qualified healthcare providers. I don't want you to cancel your insurance because you don't have access to ChatGPT or Google search and you know how to prompt it. And as a result, now you don't need any healthcare professional. No, they are there for a reason. You just have additional insight, more informed, so you can make informed decisions, right? But at least you have this tools to gather preliminary information and prepare yourself for your appointments. Do not substitute your doctor with ChatGPT or Google or Gemini or Copilot or Grok or any of the other tools. No, that's not what we're trying to share here. Then smart and safe searching is another best practice. You have to be a savvy health information seeker. And what does that mean? Verify, verify, verify. You can never over-verify information. There's always cross-references that you can do. You can check, you can prompt in so many ways. You can search over different tools, but at least make sure that the information is coming from credible sources, trusted health organizations. Don't rely on just one answer, one search result or AI answer. So compare what you're getting from ChatGPT with Google. You can also search on other search engines. You can also search with other or chat with other tools, bots, but verify and make sure you're armed with as much balanced information as possible. An example is, about being specific with your queries and your prompt. If I ask diabetes symptoms, it's going to shower me with, or provide me with a lot of different stuff, overwhelming stuff that might 50, 60, 70% might not be relevant to me, but I have to sort through it to find that out. But if I ask specifically symptoms of type 2 diabetes in a Black man, I get a more specific, tailored response. It's going to filter it better for me and I can consume it much, much, much easier. So prompting is important. How do you ask those questions? How do you prompt the tool? That's very, very important. And then know their limits. Like I said, understanding what it can't do is very, very important for you as well. Is very crucial. ChatGPT is not a doctor. It doesn't know your medical history. The knowledge can be outdated or even biased, because again, it's being trained by data, text that is out there. So if it's being trained on text on cats, that's what it's been trained on. It would not, I'm just making a joke here, but it would not be able to provide you with very, very, very poignant and direct information that is relevant to you. So there's also the bias. It's biased by the data that is trained with. So that is a limitation, obviously. And you cannot diagnose or prescribe. And Google search ranks by relevant, not always by medical accuracy or cultural appropriateness for you. So that's something to keep in mind. And then protect and evaluate. Protect your personal health information. Please make sure you don't share what is personal or sensitive to you with AI, because once you put it out there, it's out there. So evaluate who wrote it, some things to do. Who wrote this article? Are they qualified? Is it evidence-based? Is it current? Check the dates. You don't want to be referring to something from 1975 when we're in 2025. So is there a potential for bias? There is always a potential for bias, but keep that in mind. So some cautions to keep in mind. Algorithmic bias. So it's like it pulls data from vast internet data. The problem is it could underrepresent some specific communities or contain some biased medical information. It could be less accurate. It could be potentially worsen it could potentially worsen your existing health disparities if you are not careful. And then misinformation and over-reliance. We don't want you to become over-reliant on ChatGPT and become your own doctor, as I said earlier. Privacy, we mentioned that data privacy and security. Whatever you put into the chat is a way to train it as well. So be careful what you share with online. And then in conclusion, there's a human element that we can never replace. So these are all good tools, but they lack empathy. There's no personal understanding. There's the nuances of communication that is missing. And health decisions are personal and often emotional. So the need to have a human to engage with is important. So the doctors are still very, very, very relevant. And then in conclusion, ChatGPT, that can be valuable for our health information, but the key is we have to be critical how we use it, question everything, informed use, trying to understand the benefits and the risks, especially around the biases, and then be cautious how you use, prioritize professional medical advice over that. Then use it wisely to support your journey, but be responsible about it. Thank you very much. We'll take the Q&A when we get to that section. Thank you for this opportunity once again.
Thank you so much, Mr. Ogbo. I appreciate it. I am going to go on to my next presenter. Let me try to do it one more time. Can everyone see that?
Yes.
Awesome. Thank you for verifying. I can't see them. And all right. So Ms. Janae Johnson is a Houston-based entrepreneur, best-selling author, and founder of CTM Unlimited, a boutique consulting firm known for building legendary workplaces where people and performance thrive. She began adopting AI tools and low-code platforms in 2021 to run her business more effectively, and now integrates emerging tech into the solutions she builds for clients across industries. Janae is also the creator of Day, the digital doula, an AI-powered innovation tackling Black maternal health disparities. She's a proud wife and mother of 5, including 2 HBCU students, a graduating senior at North Carolina A&T, and a sophomore at Prairie View A&M. She's also a Howard University alum, a graduate of Leadership Houston Class 34, and a mentor with Goldman Sachs 1 Million Black Women Initiative. Her work sits at the intersection of technology, equity, and community, using innovation to drive better outcomes for real people. Over to you, Ms. Johnson. A pleasure to have you on board.
Thank you so much for that introduction, and good morning, afternoon, good evening, wherever you are in the world. Thank you for everyone who is joining us. I'm going to share my screen, but before I do, I think my mom is on, and today is her birthday, y'all. So I just had to shout out my mom because today is her birthday, and she's joining us from Florida. I am based here in Houston, Texas, as mentioned, and I want to go ahead and get into it. I really appreciate what Uche just shared because it fits nicely into the presentation that I'm going to share with you all now. So if you could just give me a second and I'll pull this up. So I want to start here, not just introducing the topic, but the picture here. This is my actual family. These are my actual kids. You heard a little bit about it in the introduction, but my daughter, who's in the front and who's the only girl, just graduated from North Carolina A&T about 3 weeks ago and is relocating to the DMV. So very, very proud of her. Promise I'm done with the shout outs and we're going to talk about technology, AI, and healthcare. and specifically about maternal health advocacy. I'm going to skip my intro slide because we've already talked about that, but what you will see throughout this presentation are some facts. Also, you're going to see real pictures of my real kids. So this is one of my babies from a few years ago. But here's the reason in the background around the work that I've been doing here. And it's because I have given birth to 4 children here in Harris County. After my 3rd child, I started to research what was out there and what was happening because I had a very traumatic experience. I actually had a traumatic experience twice giving birth in Harris County. And so when I started to look into it, I realized that the experience wasn't just mine, that it was happening in a lot of places and for a lot of women. And what I found interesting is that it wasn't just about women who had socioeconomic barriers, right? Because a lot of times that's the narrative. These were women who were educated, they were married, they had full health insurance coverage, and still there was bias in the system somewhere that was causing them to have these traumatic health events and even actual mortality. So trying to figure out what actually was happening, and it's not just in Harris County, but Harris County is one of the places where we have the most mortality rates, and it doesn't make sense because we also have the largest medical center in the world also. We have people from all over the world who come here for medical care. And so on the screen, you'll see a couple of things. One, this is Josiah and Noah. And when they were first born, both at the same hospital here in Houston, they looked just alike, as you can see. And the picture of me on the left is when I was actually going in to give birth. And I came in with a paper of my detailed birth plan. Because when I had Noah, I had such a hard experience being in the hospital. I wanted to make sure that it was very detailed. And so you'll see a little bit on the screen about my personal journey. I'm going quickly through the slides because I actually want to show you the technology, and I want to make sure that I adhere to time. The baby that just graduated from college, that's her in 2003. But what I'm talking about here is how AI is a potential pathway to advocacy. So there is a crisis that's happening in maternal health, not just nationally, but also specifically in Harris County. What the research has found too is that the presence of a doula during childbirth, during postpartum, drastically improves the health outcomes of that mother and that baby. However, there aren't enough doulas, and even if there were, a lot of times there are financial barriers to each woman having a doula or each expectant mother having a doula. And so there is an opportunity for us to leverage technology in order to recreate what a doula would do. Now, we know that AI does not replace the actual person. I love what Uche said about some of the things that we need to be aware of in terms of, AI, and specifically ChatGPT, is trained on data from all these places that may have nothing to do with you. But that's why I've built a custom GPT that's actually trained on data that's specifically for Black mothers, and even more specifically for Black mothers in Harris County. So this diagram just kind of explains how DD works. And then I'm going to quickly switch my screen to actually show you how it works. And we're going to try a few prompts. So I don't want to belabor these points because I think some of this Uche touched on in his presentation, but there's a lot of data that's out there. It's a lot of text, and LLMs, or large language models, are what powers all ChatGPT, Gemini, all the Claude. There's a lot of them out there. They're all powered by large language models. The way it works is that the large language models start to learn and understand context and intent in certain patterns the more you use it. And so our next step is to then train DD based on these large language models, but specifically start to give DD information. So the reason why, and the way I even came up with this idea, was a couple of years ago attending an event at TSU that was focused around maternal health. And I saw how much research and data was out there that the team has pulled together. And I have so much respect. I've said this to Dr. Ajawale, also Dr. O, that I am not a PhD, and I think I would be a snob if I was, because you have to go through a lot of schooling to actually become a PhD, and then the continuous research is a lot of work. But there is a gap where we still need to be able to deploy it to the community. And even though not everyone has access to, go to different forums at TSU, not everyone has access to even join this Zoom webinar, but most people, they have one thing, and that's a phone. And so using ChatGPT, we built this model to be more responsive and ultimately to turn it into a mobile app that puts advocacy in the hands of the patients. So I'm going to go ahead and turn over my screen to share what Didi looks like. So I will drop the link in chat after this because this is live. You can actually search the ChatGPT marketplace, and I need more people to use it. So one of the things that we're doing in this process is testing it out, because the way that ChatGPT works, the way that large language models work in general, is that they get smarter the more you use them, and it definitely matters who's using them. So with that said, we're going to try out a few prompts, and I've just kind of queued up some things that I think would be helpful. Now, one of the things that you'll notice on the screen with Didi, the voice is trained to be like a Black auntie who's real reassuring, who's all about self-advocacy, who's focused on prenatal birth and postpartum care. So if you notice, if I were to ask some of these questions in just the standard ChatGPT, it's going to give me a different type of answer. The tone is going to be a little bit different. But the way that this is built, it is built to actually have that tone and to give those responses based on those users. So for example, getting a VBAC, this was something I wanted to do after my first child, between my first and second, and I was told I couldn't. But I wanted to get a vaginal birth after cesarean. That's what VBAC stands for. And let's say I'm on Medicaid and I'm delivering at a hospital in Houston. So we're going to ask Dee that question. And it's very specific. So if you notice in the response, a couple things I want to point out. So she says, let's get right to your question, hon. It's the language around making sure that she is warm, making sure that she is responding in a way that doesn't feel robotic. And this is the question that she's giving back. And then she's explaining it in a way that anyone can understand. So talking about, yes, you can have a VBAC if you're on Medicaid, but access and provider support may vary. So she's also being very honest about like, what are the chances? And then if you notice, I because this is trained on Houston and Harris County, it's giving me all the information specific to Houston and Harris County. So it's talking about Medicaid coverage, hospital policies, provider attitudes, your rights. So there's a lot of information that comes out of this. And then it's in a way, it's intended to explain it in a way that any user can understand, regardless of their education level and regardless of how much experience or comfort level that they have with technology. So I'm going to try another prompt just to show you what else it can do. And so I'm pulling it from another screen, but I didn't respond to that prompt on purpose, just in the interest of time. But if we have a little bit of time at the end, I may do that. So my next question is, can you help me create a birthing plan that includes postpartum and nursery care? I asked that very generically because this is something that I know from my own experience, but also from what the research shows, that's having a birthing plan that specifically outlines what needs to happen, what your requests are. And it's really a way for you to advocate for yourself proactively on paper. But sometimes that can be difficult to do. And so we leverage a tool like ChatGPT and specifically Didi to create a full birth plan. And so you notice, again, her language and how she's responding is meant to be warm. It's meant to be caring, but it's also meant to be accurate and clear. So if you notice down here, it starts to build out the birth plan. So it's a space here. And I just asked this question in a few minutes. I will say I built out my own birth plan when I had Josiah 4 years ago, and this technology was not a part of that. And it took me a while to actually write it out. Now, one of the things that I do appreciate about what Uche mentioned is that you do have to verify. And so one of the things I say about artificial intelligence is that the intelligence is still very artificial. It means that you have to be a critical thinker. You have to actually be able to evaluate the output. But my goal is to build Didi in a way that helps to increase that accuracy level, because Didi is then trained on data that is for mothers who look like me. specifically. And even more specifically, we're talking about Texas and Harris County, but it applies, nationally. So these are some of the responses, or some of the more of the responses that you'll see. It outlines all the different things. And so what a mother could do would take these responses and put in her own information and say, like, oh, you know what? I don't really like the response to number 2. And so maybe I don't want to push, and maybe I know I'm going to have a scheduled C-section. So let's say that that's the case. I would say, I'm actually having a scheduled C-section.
1 minute.
How would this change? And so it's coming back. Thanks for letting me know, love. That's so important. And so it talks about how you still have rights, even though you're having a C-section. And then it has now, if you notice, it has now amended the response based on that input. So I want to just quickly switch to a call to action, and I will add this link in chat after I'm done. But my call to action is, I need people to use this. I need mothers of 1 child or 5 children. I need mothers with different experiences. I need mothers of different ages to use it, to train it, to continue to interact with it so that it can get smarter, it can get stronger. Secondly, we are working on HIPAA and data compliance. So making sure that there are privacy protocols in place before this gets released to the market. So continue to work on that. And by the way, this is something that I am just personally passionate about because of my own lived experiences. But Black maternal health is a point of advocacy for me and will continue to be. Thirdly, I am working with my church, Fallbrook Church, and we have a large maternal and infant health conference coming up in October, where we will be demoing DD to a larger audience. So we'll have hundreds of people who can start using it, testing it, and making it stronger. And so I want to just thank you all for your time. I will stop sharing my screen. I'm happy to answer any questions that you all may have in the Q&A.
Thank you so much, Ms. Johnson. I love DD, actually. I loved it. I already have a follow-up question, but I'm going to reserve that for when it's the Q&A session. And I know there are quite a number of people who are raising their hands, but please feel free to write your questions in the chat box, because it's going to help us better streamline your questions, especially if maybe you guys, people have similar questions. I am going to go.
Thank you so much.
Thank you, ma'am. Thank you, ma'am. Our last but not the least presenter is, I am sharing my screen now, so let me make sure it's showing. Can we see my screen? Because I cannot see my own screen for some reason.
Yes, you can.
Okay, awesome. Thank you. And it is a highly esteemed Dr. Amy Waterman, and she is a national transplant innovator and the Deborah C. and Clifton B. Phillips Centennial Chair for Clinical Research in Transplant Medicine. She's also a full-time professor and a director of patient engagement, diversity, and education, representing both J.C. Walter Transplant Center at Houston Methodist Hospital and the Houston Methodist Research Institute. As a health services researcher and social psychologist, Dr. Waterman conducts research in areas including how best to expand access to optimal treatments, reduce racial disparities, ensure informed decision-making, ensure patient-centered care, and improve health outcomes. She has published over 125 journal articles encompassing many components of clinical and translational research. She has designed and tested the efficacy of a suite of innovative educational resources, including mobile decision aid applications, a digital storytelling application, and texting interventions about living donation. She has been the principal investigator on over 10 grants from NIH, HRSA, and the Agency for Health Care Research and Quality. Her award-winning educational resources have been translated into multiple languages and delivered to patients in thousands of clinical settings in the US, Canada, and online. Her research also has been supported by almost $30 million in grants, and in 2019, she received the American Society of Transportation Clinician of Distinction Award for National Influence in Transportation by a non-physician. Prior to joining the faculty at Houston Methodist Research Institute, she was also a faculty member at UCLA School of Medicine in nephrology and Washington University School of Medicine in St. Louis in general medical sciences. Fundamentally, at heart, she is a patient advocate, Dr. Amy Waterman. And I'm going to stop sharing so you can share. Okay, I think I stopped sharing already.
Great. Well, so nice to be here following both amazing people and Dee Dee, the chatbot. So I wanted to say that I think I'm a really good person to end this because first of all, I do think that all of our presentations tie wonderfully together. And I want to talk today about the use of AI and digital storytelling in healthcare. And I want to also say hello. I actually run the Patient Engagement Research Lab. So what that means is I have an incredible, diverse group of researchers, educators, all of whom are working directly within Houston Methodist Hospital to conduct research using people and community-informed interventions and cutting-edge technologies to transform healthcare. And what's really important to me is we start with what's important to our patients in this time where we're going through all this technology inclusion into healthcare. And we've been talking about AI and machine learning, and I'm a psychologist by training, a social psychologist. And people are now using it like everybody knows what it is. Okay, and even how we were talking today, you guys know what AI is. And so the funny part for me, I'm like, okay, if we all said, what's AI? Okay, we know it's showing up everywhere. Everyone's talking about it. But basically, we're using a computer to look for patterns and to perform tasks without a human. Okay, very, very simple. And the piece that was concerning to me, because I'm a psychologist, that if you're in a healthcare environment, it can be scary, right? So whether you're using Dee Dee, whether you're meeting me, how do
Sorry, Dr. Waterman, your mic keeps going in and out, and someone just collaborated. Sorry.
No problem. Thanks for telling me.
Thank you.
Yeah. Let me shift the mic where the mic is. Hold on. 1 second here. I'm just going to go back in. Just checking. Check. Can somebody say, are you hearing it better in this mic?
Much better. Thank you so much.
Sure. No, thank you. All right, going back. Okay, so, all right. So going back here. So when we're talking about AI and machine learning, can you see the slides okay? Just to make sure everybody's clear?
Yes, we can.
Perfect. So with AI and machine learning, the biggest concern that I had was that healthcare, if we go into a hospital environment, the healthcare that's being provided could be robotic, right? We're all kind of mentioning that. It could be cold. It could be maybe even harming patients if there's wrong assumptions. And so because I represent the hospital, I want to say this is amazing technology, but we have to integrate it well. So what I want to propose, and I think actually we all fit together, the people who've been talking, is if you think about healthcare and you're the patient, you're right in the center of this image. You're there, you've got your family with you, you're talking to providers, you're having communication with health IT, and maybe you're going to community learning sessions. That's how healthcare used to be. It was a human-based thing. And if you look to the right, where it says there's a doctor doing inpatient interactions or telehealth, or looking at data from medical tests like a blood test that you had done. That's what it used to look like. Healthcare is changing. And now healthcare adds 2 other pieces, and we're trying to put it all together. The other thing for some of you, you might be using a diabetes monitor on your arm that is testing your blood and monitoring your data. Those are called remote technologies or education. We have at the hospital a little button called a bio button that measures your vital signs. So you stick it on you. It costs $5. And now we know how you're doing if you have a fever. It's like an ongoing thermometer for you. And then finally, if you go to the bottom of this circle, it's the AI piece that we're adding in. So how do we add in chatbots like Dee Dee? How do we use data that we have to predict people who need more support? So my commitment as a person living in a hospital environment is that we partner well across all of these different tools, and we figure out how we can engage, support our patients, and weave these through. So I hope this to me has been really helpful in having people understand all of our roles. And I think we really need to think about this because, as people said, it's not just AI that is providing healthcare, it's all of this in combination. So I want to give you 3 examples of what we're doing in an area called living kidney donation. So as we get started, I want you to think about it. So if I said to you, one of your loved ones, their kidneys are failing, and they've reached out and they said, would you ever consider being a living donor where you would give me one of your kidneys? So the question is, would you say yes? Would you say no? What kind of questions might you have? How would you make a decision to see if you're going to help your loved one in that way or not? What I say a lot of times is some people say, I wouldn't do that. I'm not going to give you part of my body, but I'm going to take you to the medical appointments and I'll learn with you. And that's a valid choice. Other people say, maybe I would if I could figure out some things. Okay, so let's just say for the sake of argument, you're saying you're a maybe. So what we're doing is we're using AI and machine learning to do 3 things: to learn what people think about living donation and what questions they have, to tailor education and media campaigns to increase the number of living donors that come forward, and to improve healthcare in general educationally in living donation. So again, let's pretend you're a person thinking about, would I ever give a part of my body to somebody? So the first thing we did is we did something that's called data scraping, which again, as a psychologist, what I have to say is that sounds very negative and stressful and painful, scraping, but it actually is pretty cool. Because what we do is we pull all the comments and dialogue that are happening in the public from public spaces like Twitter, Reddit, YouTube, New York Times. So if you look on the right, you can see that people are talking about living donation in public forums, right? Like you can imagine on a Facebook forum or in a chat room, or they've asked a question in a newspaper. So we can find all those questions, which helps us prepare education in a more effective way. And I want to give you one example. So these are questions that people are asking about, what does it cost me if I became a living donor? I could see that that could be a question you might ask, like, could my insurance pay for it? Are there out-of-pocket costs? So what we did was we pulled all of the people asking questions from all of these sources, and we grouped them into different areas. So some people were asking about the practical costs. Some people were asking about the medical cost and the insurance coverage. People were talking about, could they sell their organ? Some people were trying to figure out how to raise money for this. And then finally, people were talking about the financial impact if they were harmed later. So if their own remaining kidney stopped working, would it hurt them financially? So what I want to show you is 2 things. You can see these threads, which is the example thread, where the people, these are actually what people are asking in these public forums. We could then develop education. You can also see that there's 3 areas that people are talking more about. So it's our job as educators then to address all the questions that focus on those 3 areas. And this is about living donation, but it could be about any topic, right? Like this is what, if people are going online, and I can get that I might ask a very personal question online to someone in the, the Reddit forum, or a little note that I wouldn't ask my doctor because I would feel too shy. So it's fabulous because we can now capture all those and we can look at how to support the patients. The second thing is we can tailor education and media campaigns to increase donation rates. So what we used is we actually, same approach, we went out and looked at what people are talking about living donation in the community. And we were able to actually develop profiles of people who might like to be living donors. So we didn't know if they would, but the people we could look at the characteristics of different people. And what we figured out was there's actually 3 types of people in general that we could try to market and provide information about. This is really interesting. So if you think, let's take a sec before I give you the answer. And if I say, okay, who do you think, if you said, all right, Amy, I look around in my community, who might be a living donor for me? See if you have someone in all these 3 profiles, or if you yourself are one of them. So the first profile are there people that are caretakers in our society. They're motivated and they get touched and moved that somebody needs an organ and they know they could help and their heart is there and they really want to do this. And so what's amazing is with AI, you can actually figure out how motivated they are, how common these people are in the Houston community, how much money they make. Mostly they're female caregivers, that makes sense. And also how likely you are to actually affect their behavior. So we're using, as someone also said in this group, we're using marketing tools to actually look at how to improve health. The second group, though, is fascinating. The second group are the purpose seekers. They're people that want their lives to matter. They want to express doing good in the world. And these are community members who are racially or ethnically diverse, more likely. They're younger. They're actually very common in the Houston area. So 41% of the people that we were working on were more likely to be purpose seekers, which is interesting, right? You think it's, oh, they're heartfelt people. Well, actually, there's a lot of people who want to do good in our community, and that makes me proud. The final group are pragmatists. So pragmatists are saying, my life is pretty good, and I see there's this practical thing I could do. I could give a kidney to somebody, and it would make a big difference for their life. So you know what? If it doesn't hurt me, I'll do it. And so we have a group of people who are that group as well. So these people, basically the cause has already touched their life. So they know someone who got a transplant, they're donating blood already, but they're like, you know what, I can do this. So we built a campaign and this campaign's really great. The campaign is very simple. It says, how far would you go to help save a life? How about a few inches? So this is the scar of what a living kidney donor would the doctor would cut. This usually happens right in the lower area of your right side, kind of near where your underwear would be. And this is the size of a surgeon's hand. And that's what it would take to save a life. We then sent this campaign to people on social media, we had public service announcements, and we connected with Houston-based influencers. And I want to show you something cool. So people say that all the generous people who want to be a living donor have already showed up at a transplant center. This campaign said that's absolutely not true. We delivered 27 million impressions, meaning little ads about this campaign. And we had 120,000 people in the Houston area who went to learn more about living donation, just from saying, would you look at this ad, would you ever save a life in this way? And what's also amazing and exciting is we're figuring out how to get, there are some of those people who want to start living donor evaluation, and they did. And we have people that are undergoing evaluation to be a donor now. So this not only leads to people being interested, this leads to people becoming donors. So it's very exciting. The last thing I want to say is we've been building different educational tools. So the first one we built was a storytelling project, and you can go to the storytelling site, and every single face here are real people who've donated kidneys in their lifetime. They're still here, and they really wanted to share about that on their phone. So what we did is we built a set of prompts. So you can see up here, it says, hi, I'm Amy. I donated my kidney to my dad about 9 months ago. And then the prompts keep going, and they're open-ended, but the person can say anything they want to say after the prompts come up. And the technology strings it all together. So now you have a story from Luther or Doris or Marlo. And it's been amazing. What I want to say is I highly recommend you listen to some of these stories, but this is about the wisdom of living donors now being available in a library. And we can also send these stories forward on social media as well. So now you can hear and meet a real life person without causing any stress for you. You can just go and listen to the library and say, that resonates for me.
1 minute.
Okay, last thing, and what's great is Dee is even better than what I presented. We can do the same thing with asking questions with living donation as we can with asking questions about maternal health and about giving birth. So we can have people go and learn about living donation in that way. The final thing I want to say is that there's a US policy that the development of AI must proceed ethically. We need to be novel and innovative, but we need to make sure artificial intelligence is safe and secure, and artificial intelligence policies must be consistent with advancing equity and civil rights. Thank you.
Thank you so much, Dr. Waterman. Appreciate it. Really love it. Really love it. I'm going to move ahead because we are a bit short of time to, let's see, let me share my screen again. Let me know when you all can see it, please. Is it showing now, my screen?
Yes, we can.
Awesome, thank you. I am gonna go on, just give us a friendly reminder. Please, thank you for those who are hanging there with us, and I really find this information interesting. Thank you for your questions and questions that have also come up. Again, our CHWs, you have two credit hours you can claim as long as you fill out the survey and do the evaluation. We will send that to you within 2 weeks. For those again who are still following us on Facebook and YouTube, please feel free to share again, and you have the QR code there, please. Or the link also in a chat group to please fill out our service. Those are very important, and they provide us feedback, which we also send to our grant people. So we thank you for that in advance. Without much further ado, I am going to bring up our moderator for this panelist session, and it is Ms. Edith Decline, who is a nurse practitioner with extensive experience in primary care, nursing education, community health, and clinical research. She holds a master's degree in nursing from the University of Texas Health Science Center in Houston, where she's currently pursuing her PhD with a focus on culturally tailored approaches to preventing and managing gestational diabetes mellitus in minority women. She holds a bachelor's degree in nursing from Prairie View A&M University, as well as an associate degree in applied sciences and a licensed vocational nurse certificate from Houston Community College. Additionally, she has earned a bachelor's degree in math and education from the University of Abuja, Nigeria. She is committed to preventive health education, and research is deeply personal, driven by the loss of her father to diabetes and its complications, and her only sister to the complications of gestational diabetes. Ms. Edith. And then also, if you don't mind, we're also going to go ahead and also bring up again our speakers, Dr. Tamika Cross, Mr. Ogbo, Ms. Johnson, and Dr. Waterman. You can go ahead and turn on your screens while the panelist session is going on. Thank you.
Thank you so much. Thank you very much for that introduction. It's my pleasure to be here today. Thank you to all our speakers. You have spoken very well. I have learned a lot, especially with regards to how AI is shaping our healthcare delivery these days. This is something that I believe even more people should hear about, because you know what they say about life. Huh?
Sorry, you have an echo. Can anybody else hear it? There's an echo as she speaks. Okay. So I'm not sure what you need to fix. Is the phone on, or do you have a second plug?
Just a second. Let me move my computer around. Hold on.
Thank you.
Okay. All right. Let me know if this is better.
Just a tad bit, but feel free to continue. Thank you.
Okay, thank you very much. So in order not to waste our time, we don't have a lot of time left. We're going to start with the first speaker, Dr. Cross. I have some questions for you, and hopefully we're going to have some more questions from the audience, but we'll be very, very happy to get your responses from these questions. So the first question I have here is, how are physicians and public health agencies using social media to improve patient care?
Yeah, I think that's a great question. When it comes to physicians and public health agencies, using social media to improve patient care through accessibility, myth busting, patient education, patient empowerment, public health campaigns, like I mentioned briefly during my talk about, like, COVID-19, I think was a big one, just pushing things out so people knew information on what to do, where to get vaccinated, things like that. And then also just being able to extend the reach, beyond the four walls of a clinic. I think all of that is important in ways that we see that improvement.
That's wonderful. Thank you for that response. And I really, when you were speaking, I really appreciate the fact that you are employing the use of social media to reach out to this population of patients and not necessarily waiting for them to come to you, because we have to go meet these patients where they are. So thank you very much for that. So the next question would be, considering the mistrust issues in the minority population, what role can social media play in increasing the health literacy and patient empowerment?
Yeah, so I think providing culturally relevant information. So again, like I touched on it briefly, but I want to go a little bit more in depth. But being from an inner city community, being a woman of color, I think all of those things definitely resonate with my patients who are can relate to that. And so when it comes to targeting certain topics that I may educate on or things in content that I want to put out from that standpoint, I think patients feel a little bit more comfortable with somebody that looks like them, that understands their body, understands things that they're facing, understands the discrimination in the system that happens because I show up and I'm a patient too. I don't walk around with a white coat in the community. So I definitely know both sides. And so I think that helps to kind of break down those barriers and have a more trusting relationship and building rapport with our patients from that standpoint. And so just from a representation standpoint, but I also think destigmatizing taboo topics is important because I think I know in the office, at least when I'm speaking to patients and doing patient consultations, and I ask patients like, okay, so how's your sex life? And they're like, whoa, right? They weren't expecting me to ask that, right? And so talking about those taboo topics, but it's like we should be able to normalize those things. We should be able to talk about menopause. We should be able to talk about vaginal dryness. We should be able to talk about odor and things like that. And so basically, I think by having somebody who's relatable, who's talking about those uncomfortable topics and destigmatizing it and making it more normalized, I think is definitely going to help break down that mistrust of the patient provider barrier.
That is wonderful. Thank you so much, Dr. Cross. I love the think like them, look like them perspective because most of the time we send the wrong messages by sending the wrong messengers, if that makes sense.
I like that. I like
Yeah,
that.
so I really appreciate that perspective. Now I'm going to switch over to one of the other speakers, and then we'll come back to you if time permits. Is that okay? All right, perfect.
Yeah, of
So,
course.
Mr. Ogbo, you talked so much about ChatGPT from an IT specialist perspective, and I really appreciate that. Thank you so much for that insightful, very valuable input. Now, my question would be, in your entire experience as an IT professional, how accurate has ChatGPT or Google been?
Ooh, that's a difficult one, isn't it? Um, it's like I said, you can never be overly cautious with those tools, right? So it's very, very crucial that you validate whatever it spits out to you. Yeah, I have this with my computer background. There's a notion of garbage in, garbage out. Whatever the tool is trained with is what is going to give you perspective on, right? So you have to be very cautious there. So that's why the good thing is the new versions now have references, right? We're talking about your health. So you can't treat it like instant noodle where you throw it in the microwave and you spend 3 seconds and you're running with the information. No, you have to spend time and do a research on the information it presents to you. So you treat it with some level of importance that it deserves, right? So it's getting better. The quality of the data, the quality of the output is getting better. But one thing that I would highly encourage a lot of people to do is to learn how to ask the question the right way. There's a way you can prompt those tools, right? If the 504s go ask Google the same question, right, but in different ways, it's going to give you different answers, responses. You can find similarities, but the overall output will be different. Same thing with ChatGPT. I can ask it a question, and you, Edith, can ask it the same question in a different way, framed differently, and you will get different responses. So the prompting is crucial, and that the good thing here is you're able to tailor it to your specific situation, your demographics, and all that kind of information that's relevant. So I would say it's getting better, but there's still some hallucination, especially with the AI tools. And there's a notion in Google search that is called search engine optimization. So basically, if Dr. Cross is able to pay for an SEO and they optimize her content, and Ms. Johnson didn't pay for SEO, Dr. Cross's information will always be at the top because it's been optimized to show up at the top. So some of the things to keep in mind. But again, I would never overstate the importance of validating what it presents to you. So do additional research beyond what it just shows you on the screen.
Now, that's a very wonderful response. And there was something you had mentioned earlier, which also resonates with what you just said about prompting, the right prompts. Because I realized that, I mean, you are Uche Ogbo, you're African American, somebody else, maybe Jimmy Walker, African American also might want to prompt ChatGPT for the same response, but will not understand that there are other components. Okay, there are other things that make up Uche that is different from Jimmy Walker. Okay, social determinants of health, where Jimmy Walker lives, what he eats, his support system, and all of these things contribute to the entire picture. So most of the time when we enter this prompt into ChatGPT, it doesn't have the entire picture to be able to come up with the precise solution to the problem. So I really do appreciate that. Thank you so much for that. I'm going to take the next question for Ms. Johnson. Thank you so much, Ms. Johnson. It was absolutely wonderful learning about Didi. I share your experience, the childbirth thing, and honestly, I wondered how people who were not as educated as we are or as privileged as we are, I wonder the kind of experience that they get if we get some of these experiences in healthcare. So I really appreciate you for taking this initiative, and I strongly believe that this would help improve maternal health outcomes significantly. Thank you so much. So my question would be, why is the human element considered irreplaceable in healthcare despite advances in AI? So now we have the doula, Didi, right? So how is doula trying to be or incorporating some human elements to its interventions?
Yes, I think there's two answers to that. One, as much as we train Didi to respond to a specific population, it still will not replace having a human there who can put their arm around you and say it's going to be fine, who can speak to your doctor on your behalf. It doesn't replace that. This is a stopgap solution to really save lives. Like, this is a way to scale a solution that we know that works, that we know has been proven in research, but there is not a way to assign a doula to each mother who's giving birth. Even if we just said in Harris County, there's just not enough doulas, there are financial constraints. So it will never replace it. I do not see a world where having a human right there to hold your hand is going to replace it. However, some of the resources, the language, the encouragement, the support, those kind of things, the digital doula can do. Until we can start to see those numbers come down, we have to do whatever we can to save lives. So that's the first part. I think, secondly, the technology is only as smart as the human. So one of the things that Uche said, it is garbage in, garbage out. And it's not even just garbage, it's just if you only have certain types of people using the technology, then the output will only produce whatever their bias is. It will only reflect the types of questions that they ask. It will only reflect what they validate as an answer. So even with ChatGPT, there's a validation process where you can say, nope, that's not the right answer, or yes, I like that answer, which trains the technology to give you more answers like that. So we need humans in order for the technology to be better and smarter. And specifically, we need diverse humans, because the original technology was not necessarily built by diverse humans. So we need people of all backgrounds, races, genders, ethnicities to use it.
Well, that's wonderful. Thank you so much. I really appreciate that that response, because sometimes we forget that AI is not human, in as much as it's trying its best to be human, but it still has its limitations. And but we cannot completely do away with it, unfortunately. So thank you. We still need humans, for that human component of the healthcare process. Thank you so much, Ms. Johnson. Now, my question for Dr. Waterman, I'm going to take a question from the audience, and then hopefully we have time for some of the questions I have here. So the question is, Dr. Waterman mentioned great tools enables patient advocacy. Can you measure and manage the value proposition?
Yes, I saw the question came in. So compared to what would be my first question, right? So as we build these tools, how can they be valuable? So what I really respect from what the person asked is that these tools have to help patients get to health outcomes and do better. I think everybody here, you can build all sorts of cool things. But the difference with AI and health is everything has to improve health. It has to improve informed decision-making. It has to empower the family. So to me, if we name what the value proposition is first, and we say, okay, that we built this, so whether it's DD, whether it's storytelling, whatever the tool is, how do stories help? So to me, there are many people who say, I might donate a kidney, but I don't know yet. So to me, we need to build all sorts of things that anyone can use, learn, talk to their family about. And some people will say no. And some people will say, I think I'm going to keep going. And if we have more living donor transplants because of better tools out in our community, I think that's the value proposition that pays off. How do you feel, if I could throw this to my DD partner here, what would you say you would feel happy if DD made possible in the maternal community?
So I think because there's so many metrics specific to Harris County on the mortality rates annually, if we even saw a 5% decrease year over year, then I would know we're moving in the right direction. And if we could trace that back to mothers who have access to DD, who are going through their birthing experience and seeing different outcomes. So I feel like the metrics are very easy to measure because there are so many metrics that talk about what's happening, and we're not in the dark about, well, is this disproportionately affecting Black mothers? It is. Like, the data shows that over and over.
Yeah. I also, in the case of our chatbot, what I'm really fascinated by is what are people organically asking it?
Yeah.
Right? Like, so what are the common questions people have about living donation? Right? If we know the top 10 questions being asked to the chatbot are these 10, it seems like when we're talking to patients, we'll make sure that stuff's covered as well. So I also think it helps to guide the humans to be really in the listening of the patients more. And we don't have to say, well, what are you scared about? Well, look, if all these people are asking the chatbot something, we go, I bet they're probably scared about this. And this could be, we could start more with people in the limited time that the human care providers have, so that people will go, how did you know I was scared about that? And I go, you know what? Many people are scared about this. Is this something you're concerned about? And they're like, whoa, how did you know? And I'm like, well, because all the AI data is showing us that you're normal and this is how it feels. So to me, there's a lot of value of using the tool, but also from a human technology co-care model, right? What do I need to say? What does the tool need to provide? What data do we have? And fitting it all together.
And I think, Dr. Waterman, this is the reason why I'm pushing so hard for people to use it, because then we can really start to collect data that we feed back to the humans who are also advocating. So that's the medical staff, that's the doctors, that's the hospitals, that's the TSU team that's assembled here. It's all the other researchers around the globe who are really trying to solve the same problem, that it gives us something to give back to them and say, hey, this is what people are asking for, and here's where some of their concerns are.
Exactly.
Thank you so much. Thank you very much, Dr. Waterman, and thank you, Ms. Johnson, for all of those. We really appreciate you. So we're going to try to hurry up so we don't take too much of our time. The next question will be for Mr. Obo. How can digital tools help improve self-advocacy in healthcare for community members? Because I know we had talked about, at least having an idea before you go to the doctor's office. So how can we further use these digital tools to improve our experiences, our interactions, and treatment plans when we go to the doctor's offices?
Yeah, it's all about empowering us with knowledge, right? That knowledge is very easily accessible now because we have all these tools, and majority of them are free. You don't have to pay anything for it. Like I said, as long as you have a basic data plan, you should be able to do a Google search. You should be able to do, you can download some of those tools. ChatGPT has a free version. Gemini is on most Android phones right now. So there's a lot of tools out there. And it's about asking those questions, getting better insights, understanding how it pertains to you, so that when you engage with these medical professionals, keep in mind, as much as they are experts, they are human beings, right? So a doctor can show up on a day and he's having a horrible day and he's not able to provide you with that insightful knowledge that you seek. And then you can challenge that doctor based on the information that you've picked up. And it's up to the doctor to correct you, affirm what you're saying, or just set you on the right path. But at least the doctor knows, hey, this is a patient who's aware, right? And whenever they show up, I have to be on my P's and Q's. I have to know what I'm saying. So because this patient will ask me questions, they will challenge me. And I think because it's our health, if a doctor makes a mistake, it's going to show up on his record. He might get depending on what the mistake is. But you're the one to deal with that mistake because your health is impacted. You might even end up dying as a result. So it's something you need to take more seriously. And these tools will give you information that you can use to engage with the doctors in a more, intelligent way, where you ask them questions, you challenge their opinions, and it's up to them to, clarify what they are recommending or prescribing for you. But basically, those tools are empowering in that regards. So as far as self-advocacy is concerned, this is something that helps you, advocate for yourself, if I can say it that way. But it's very, very, I can never say it overstated. It's very, very important that we know how to use them and engage with our professionals in a more intelligent way at the level that they would appreciate as well. Like I said, I don't want you to go to see a doctor and you're fighting with your doctor and you're always ready to throw a fist and argue because ChatGPT told you something. No, just go in there and engage them in a very intelligent way.
Thank you very much. Thank you so much, Mr. Obo. So I'm going to take one question now, and hopefully when we're done with that, we'll see how much more time we have left for the other questions. Now, this is going to be for Dr. Cross, and the reason I'm directing this question to you is because I believe it kind of envelopes everything we have talked about. We have patients on here who are willing and ready to hear how actually or what the next steps would be going forward. So, how can community members identify credible healthcare professionals? And now, this is because we have identified a mistrust issue that has stood as a barrier, okay, from people accessing healthcare. So, but how can community members identify credible or trustworthy healthcare professionals to listen to or to follow for health-related information on social media platforms? Because we know it's a lot of people right now, talking about everything. But how can we identify the credible ones who we can follow online and maybe actually in person?
Yeah, I think that's a great. Can you hear me? I think that's a great question. I think the first thing that's most important is look them up, right? So if they have their name out there, they have their credentials out there, which they should. Look them up and see if that's really who they are. Look up and see if they actually have a website. If they say that they're a practicing physician, they should be on somebody's website. If it's not their own practice, they should be working at a larger facility, and there should be a bio on them to verify that. So I think that's important. Versus I see a lot of people, especially now, throwing around the title doctor. And so when it comes to that, it's like, okay, there's some people who just like, oh, I like the way it sounds, I'm gonna call myself doctor. But it's like, see if they actually have a doctorate. And then what kind of, are they a medical doctor? Because you can have a PhD in a lot of things and be a credible source when it comes to certain things. But then it's like, if they're giving medical advice, they should have an MD or a DO. So when it comes to those different things, I think it's important to look it up. Also, you can look up board certifications. So if somebody has had a medical degree for many years and they still are not board certified, that's a red flag. Why are they not board certified? Why are they not recognized by, like for me, I'm OBGYN, so recognized by ABOG, American Board of OBGYNs. So you can look those things up. You can look up their license if their license has been taken. And I know it sounds like more extra work that some people may not want to do, but I think it's important, especially if they're saying something and it doesn't sound right, or they're saying something and you're going to be using them and saving some of their posts. It's important that you're saving somebody from that's an actual credible source. I think another thing to look at is look at people who are referring to each other, right? So there's a whole network of us on social media. There's a whole network of us in the community. And so it's like, I have a list. People are like, I need a PCP. I'm like, okay, you want to go here? You want to go there? I have options. So also sometimes getting that from your credible source that you know, and seeing who they recommend in different areas. Like, okay, well, who's a surgeon for this, and who's a good pediatrician for this, and who, et cetera. So I think asking people, your professional network that you already have vouched for and have already checked their credentials, you can look at their recommendations and referrals, but then also looking people up, which now, because technology is so robust, you can look somebody's credentials up within less than 2 minutes.
That's wonderful. Thank you so much, Dr. Cross. And that also takes us back to what Mr. Ogbo had said. He said, verify, verify, verify. Don't take everything you see out there and run with it. It's very important to verify the source, make sure that the information you're getting is correct, and the person who is talking to you is credible enough. All right.
Exactly.
So I'm going to pass this on to Dr. Jolie. In the interest of time, we're going to be rounding up the panel discussion section. And thank you all so much for the insightful and wonderful information that you have shared with us today. It's been a pleasure, and I hope you enjoy the rest of the program. Thank you.
Awesome. Oh my goodness. Can we give a virtual round of applause for this amazing panel session and speakers? I'm like, oh my goodness. Now, thank God for technology. This information is not going away. I mean, if I was taking notes, my book would be filled, with all the great information that has been shared today. But this information is being recorded on YouTube, Facebook, and it would remain there. I am definitely going to go back and listen to several of these key nuggets that has been shared by these amazing speakers and panelists. I am just very grateful to each of you for sharing out of the wealth of your experience with us today as a person and as a community member myself. I also, as an individual, seek care. So I have received a lot of information today that I'll put to good use, in my own personal, healthcare usage as well. But thank you, Edith, for moderating that session. And thank you so much to all the panelists and the speakers that we had today. In closing us out, I'm just again sharing gratitude to the community, right? We've been on this session for almost 2 hours now. Okay, it's right at 1 o'clock, so right about 2 hours, in this session. But thank you all for engaging with us. This is just the beginning of many great engagement to come forth. From listening to the speakers, I definitely have some ideas of how we can continue to engage as an institution and continue to meet the needs of the community. But thank you all for engaging with us in this session this afternoon. And this is Community Engagement Core. We have a lot of information. We have a lot of programming that Dr. Ogbo will be sharing as we go into our closeout announcement. And I'm saying a big thank you also to our support team, everybody within the TSU IAT team, Dr. Ogbo and everyone else, as well as Constellation X, the technology group, right? Ensuring that we stay focused while we are doing this and they are handling some of the technology things on the back
end. To the leadership of Texas Southern University, Vice President Michelle Penn Marshall, Senior Associate Vice President Dr. Monica Lale, and to all the leaders of the CBMHR, we are very grateful to you all for your support, and most importantly to you, the community members. Thank you for your continued engagement with us here, and we look forward to seeing you in our future events. Dr. Ogbo, I will pass this over to you for final closeout announcements. Thank you.